How does the coronavirus spread? Data has shown that it spreads from person to person among those in close contact within about 6 feet or 2 meters. The virus spreads by respiratory droplets released when someone infected with the virus coughs, sneezes, or talks. What are the symptoms of COVID? COVID-19 symptoms can vary from mild to severe. Some people have no symptoms. The most common symptoms are fever, cough, and tiredness. Other symptoms may include shortness of breath, muscle aches, chills, sore throat, headache, chest pain, and loss of taste or smell. This list is not all inclusive. Other less common symptoms also have been reported. Symptoms may appear 2 to 14 days after exposure. Can COVID-19 be prevented? A vaccine isn't currently available to prevent COVID-19. What can I do to avoid becoming ill? The best way to prevent illness is to avoid being exposed to the virus. The CDC and WHO recommend following these precautions. Keep 6 feet of distance between yourself and people outside of your household. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Throw away the used tissue. Avoid touching your eyes, nose, and mouth. Clean and disinfect surfaces you often touch on a daily basis. If you have a chronic medical condition and you may have a higher risk of serious illness, check with your doctor about other ways to protect yourself. Should I wear a mask? The CDC and WHO recommend that people wear cloth face coverings in public when social distancing is difficult. This advice is based on evidence that people with COVID-19 can transmit the virus before they realize they have it. Using masks in public may help reduce the spread from people who don't have symptoms. Non-medical cloth masks are recommended for the public. Surgical masks and N95 respirators are in short supply and should be reserved for health care providers. What can I do if I am or may be ill with COVID-19? If you develop symptoms and you've been exposed to the COVID-19 virus, contact your doctor for medical advice. If you need to go to the doctor or hospital, call ahead so healthcare providers can take steps to ensure that others aren't exposed. Take the following precautions to avoid spreading the virus. Stay home from work, school, and public areas except to get medical care. Avoid public transportation, taxis, and ride-sharing if possible. Wear a cloth face mask around other people. Isolate yourself as much as possible from others in your home. Use a separate bedroom and bathroom if possible. Avoid sharing dishes, glasses, bedding, and other household items.